I knocked on the door, closed the door, provide patient privacy, perform hand hygiene, introduce myself as RN Hayes, and of course I want to do a 2-patient identifier. Name, and then birth, or any other identifiers, but date of birth preferably on the arm. Patient has identified themselves, I introduce myself. If there's a person in the room, I would do my HIPAA procedure, meaning I would let the person in the room, I would ask the patient, is it okay for any information I reveal to you, Teddy, to this person, is it okay? If they say no, I'll ask the patient to leave the room. If they say okay, the patient stays. Look, I would do the equipment that I would use would be a tape measure, blood pressure, stethoscope, Doppler, and a scale and a marker. Next thing I would do is take vitals, blood pressure, temperature, heart, rate, and respirations. While I'm doing that, of course, I would tell the patient the procedure that we're doing today. And the procedure we're doing today is peripheral vascular systems. Now, what I would do is I would start from head to toe. I work from the head and work down to the toes. Now, while I'm doing that, after I've done that, I would do a pulse deficit along with taking my vitals. Pulse deficit meaning I would take the radial pulse and the API, and I would take the difference. So I would take the API minus the radial pulse to get the pulse deficit. The reason why I would do that is to see if there's any arterial fibrillation. Also, if I did that, I would take a full minute on the radial and the API, and how I would get the API is angle of Louis, about the 5th intercostal, going down to just left of the nipple down here. Place my stethoscope. I would listen for 1 full minute. When I get the radial pulse, I'll take that for 1 full minute as well. Also, anytime I use the equipment, I would always clean it. This is my alcohol pad. I would clean my stethoscope before and after use. Before I use with the patient and after. Next thing I would do is I would inspect the arms. I would do both arms at the same time, using my hand, checking for anything. I'll look for color, size, and lesions. Palpate. As I said before, I did the radial. I'll also do the brachial as well. I would also check under his arm for the epitracheal node. Checking for firm, checking to make sure it's not, there's no firmness to it, no masses. While I'm doing that, I inspect the skin, I inspect his hand, I inspect his nail beds, make sure that there's no clubbing. I check the angle of the nail, and everything was fine. Also, I would inspect, as I go down, I would inspect the legs, and I would do the same thing. While I'm doing that, I'll use the back of my hand to check for temperature. And if I had an issue with a pulse, I would use a Doppler if I had a hard time finding it. And if I did have a hard time finding it, I would mark that spot with a marker. And I'll put a notation in for a person coming behind me. I would check the skin area for any edemas. Also, as I go down, I would check the femoral artery, the popliteal just behind the knee, the posterior tibial, and the dorsal pediis pulse. While I'm doing it, right here, I would check for any edema or pitting. If I did see that, I'll probably use a tape measure to see if I had any pitting. We did not see any. Also, I would check while I'm doing that. I would check to see if the pulse is full and bounding, weak or thready, or any other type of pulse like a Corrigan where it starts off strong and it goes down, it trails off. But I did not see any of that. Now, while I'm doing that, I would do subjective data, like leg pain, was any cramps, skin changes in the arms and legs, swelling. Once again, I told you about the lymph nodes, enlargement, and medication. Now, documentation, what I would do after I'm done, I put down equipment, clean it off, wash my hands, and I would do documentation. Document meaning I would say there was no leg pain, no skin changes, no swelling, lymph nodes, enlargement, no history of heart or vascular problems, diabetes or obesity, ask if they smoked or not, and no medication. Last thing I would do would be, objectively, I would say extremities have pink tan color if they're Caucasian, or normal skin pigmentation if they're if they're African American or another race. No redness, no cyanosis, no skin lesions, extremities is symmetric, and no atrophy. Also palpitation, I would say temperature is warm, and bilaterally, all pulses are present, 2+, and no lymphadenopathy. Now, one thing I would do is, while I would do this, I would try to do both at the same time for the legs and arms to see if there was any difference. My assessment would be healthy tissue and effective tissue perfusion. Last but least, I would ask the patient, do you have any questions, any concerns, before I would even start education or health promotion. Next thing I would do is health promotion. For a person that did this, if they had diabetes, I'd make sure, by the way, yes. If somebody did have diabetes, I would take a look at their feet. Make sure there was nothing going on with their feet. Anything like if they had long fingernails, I make sure they go to the foot doctor. Make sure to get that clipped. We do not clip it, just go at the foot doctor. If there's any wounds or anything, make sure to have specialists like a wound nurse or doctor to look at that and make sure we stay on top of that. And then after we did that, we do health promotion. Because if we had this, then we talk about how we could better treat your feet. We could either do exercises or make sure you keep your scheduled appointments with your foot doctor. Also, how to wash your feet. Also, make sure if they wash their feet, then this water's not too hot. It has to be warm because they can't feel pain. Also, you wash your feet on a regular basis. Dry your feet carefully after a shower or bath. Keep toenails trimmed. That's to keep the blood flowing to the feet. Okay. At this point, this evaluation's done. The next one we're going to do is lymphatic systems. Okay. We start from the top again. I knocked on the door. Provide patient privacy. Perform hand hygiene. I introduce myself. I'm RN Hayes. I want to do a 2 patient identifier. Look for name, and as always, date of birth. It doesn't always have to be date of birth. It can be Social Security, but date of birth is best go to. Also, if there's someone in the room, we do a HIPAA procedure, meaning I would ask Teddy, hey Teddy, is it okay that this person here is with you if I reveal any pertinent information or personal information? Teddy says yes, the person stays. Teddy says no, the person has to go. But we wouldn't be that abrupt. We would say, because of HIPAA, we have to leave. So you can wait in the waiting room when we're done. We'll bring Teddy out to you, or we'll bring you in, whatever works. Want to make sure we're not confrontational. Just let them know this is a procedure and this is the patient's right. Also, the equipment we would use would be a stethoscope, maybe a light, and then next thing I would do is I would inform the patient of what I'm about to do. This time we're doing lymphatic systems, and we're going to do a check on his lymph nodes over his body. Okay, we're going to check. We're going to do an inspection. We're going to do contour, where we stand on the person's right side and stop to gaze across the abdomen. Determine the profile from the rib and margin to the pubic bone, normally flat and round. We would look for symmetry, making sure pretty much what's on this side is the same on the other side. Shine a light. Probably having the patient laying down. Towards lengthwise across the person's abdomen to see if the symmetry is bilateral. Note any localized bulging, visible mass, or asymmetry. Next we would do is we would check the skin for any lacerations, any change in color, pallor, and we do a pulsation movement. And we check the demeanor of the patient. Next, we do oscillation of the bowel sounds. We start at the right lower quadrant. That's where most of the bowel sounds start. Now the quadrants would be right lower. This is the way we would go. So right lower quadrant, right upper quadrant, upper left quadrant, and lower left quadrant. Here would be somewhere is the aorta. About down here is the iliac and femoral artery down here. What we would do is we would do auscultate bowel sounds. So I would listen for about 5 minutes in each quadrant for any bowel sounds as I move up systematically, and I will come down. Also, while we're doing the bowel sounds, we note the character and frequency, normal, high pitched. We will check to see if there's any hyperactive bowel sounds. We also check if hypoactive, there's no sound. You must listen and also basically listen to 5 minutes of the bowel sounds, and they're all complete and absent. Next, we would do palpitations. Palpitations, what we do, you could do it light. Or we might have to do deep as needed. Now, while we're doing all of this, we're going to be checking for any tenderness. And if we do find tenderness, we look for the location, size, shape, consistency, meaning soft, firm, or hard, surface, mobility, movement, pulsivity, and once again, just dealing with the tenderness. the organ is enlarged. At this point, while I'm doing that, I'll probably be asking the patient, has there been any change in your appetite? Dysphagia, difficulty swallowing, food intolerance, abnormal pain or abdominal pains, nausea, vomiting, bowel habits, retinal conditions, past abdominal history like an ulcer, gallbladder disease, hepatitis, appendectomy, colitis or hernia. Also, we ask about medication, including over-the-counter antacids. We ask if you're using any alcohol, drugs, cigarettes, and nutritional assessments. Once we would document. We would, in our documentation, and I'm sorry, once again, once I finish my assessment, I clean my equipment with alcohol pad, put that away, wash hands, and I do documentation. And I would probably state appetite is good, no recent changes, no dysphagia, no food intolerance, no pain, no nausea, vomiting. Had one, asked if they had a good bowel movement. BM, make sure I wouldn't say BM to them. I'd ask them, did you go to the bathroom? Have you gone to the bathroom in the last day or so? Takes over-the-counter multivitamins, no other prescribed or over-the-counter medications. History of abdominal diseases, injury or surgery. Dot recall in the past 24 hours, a list end of history. So, our inspection would be abdominal is flat, symmetric with no apparent masses, skin is smooth, and scarring and no lesions. Auscultations, bowel sounds were present, no bruit. Tympany predominates in all four quadrants, that's with the percussion. Palpitations, abdominal soft, no masses, no tenderness. Now, this is where, at this point, I would ask the patient, do you have any questions? If they don't have any questions, I would go on to my health promotion for the patient. I would talk about probably hepatitis C, B or C, what it is, how it can affect you. Also, I might talk about high risk individuals should be screened for hepatitis B and C. At this point, I will conclude the examination. Thank you.